Hello guys, and welcome to today's episode of learning. And guys, welcome so much to my YouTube channel. And remember, we said in this channel we discuss the basics of different illnesses. And as humans, we are all prone to getting ill. And so in this channel we discuss about various illnesses and what can you do just in case you find out that you have one, or you can be able to help a friend or a family member. And so this channel is basically meant for everybody. So I welcome you all. Please watch my videos and also share with your friends and family members so that everybody can get to know this basic information. And so today I want us to talk about pneumonia, also a very, very common disease that affects mostly children and also elderly people. So I welcome all parents to watch this video so that you can be able to tell because pneumonia basically accounts to 15% of deaths in babies. So I call upon all parents to really be keen, because pneumonia in children is so common. So I will just define what is pneumonia. Pneumonia is basically an infection to the lungs. Our bodies, there's an organ in our body called the lungs. We have two lungs, the right and the left lung. And the function of the lung is to get oxygen from the air we breathe in. So oxygen is transported to the bloodstream through the lungs. And also the lungs help in getting rid of the CO2 that the body produces. So the function of the lungs is to get the oxygen from the air we breathe in. It is transported to the bloodstream or the red blood cells through the lungs. It also helps to get rid of the CO2 that the body produces through breathing out or exhaling. So that is the function of the lungs. And in the case of pneumonia, the lungs are the ones that are infected. So the lungs are filled with small air sacs called the alveoli. So in the case of pneumonia, the alveoli are the ones that help in transporting the oxygen we breathe in to the red blood cells. And so in the case of pneumonia, you find that the alveoli, they are filled with pus or fluid. So and you know the function of the alveoli is to get the oxygen that we breathe and transport it to the red cells. And so once you are infected with pneumonia, instead of them in a normal person, they are air filled. But now once you get infected by pneumonia, they are filled with a fluid or pus. And so it makes it difficult or painful to breathe. And you start coughing. So basically that is what happens. You are infected by a bacteria, and the lungs become inflamed. They are filled with the pus and fluid. So what or how is pneumonia transmitted? How is pneumonia transmitted? First, the causes of pneumonia are we have bacterial causes, bacteria. We have viruses, and we also have fungi. We have bacteria, we have viruses, and we also have fungi. Those are the three causes of pneumonia. And so I will take you through some of the bacteria that cause pneumonia. We have Streptococcus pneumonia. That is a bacteria that resides along the respiratory tract. It's found mostly in the nose, in the nostrils, or on the throat of a person who is healthy. But when it is inhaled to the lungs, it causes an infection. This bacteria, it resides in the along the respiratory tract of a healthy person. It resides there, and it's not harmful. But once it's inhaled to the lungs, now it causes pneumonia. We also have another bacteria called Haemophilus influenza. We have viruses. We have one of the viruses is we have pneumocystis jirovecii. That's one of the viruses that cause pneumonia, and it's mostly found in babies. Yeah, and so pneumonia, how it's transmitted, you find that number one, the bacteria that resides in the GI in the respiratory tract as a normal flora. By normal flora, I mean it lives there, but it's not harmful. But when it's inhaled, it causes when it's inhaled to the lungs, it causes an infection. Another way pneumonia is transmitted is through respiratory airdrops. This bacteria that cause pneumonia, they are contagious, meaning they can be transmitted to another person. An infected person, when they cough or sneeze, they release the bacteria to the air, and so when you inhale them, they infect you. Those are the two common ways: through inhaling the bacteria to the lungs, and another one, it's contagious through coughing or sneezing. You can contact it. That is how it's transmitted. What are the symptoms? What are the symptoms of pneumonia? Number one, a symptom, we have coughing. Number two, we have chest pains. You find that these people, they have an acute pain of the chest when they breathe in. Number three, we have fever. They run temperatures of above 37.7. We have fast breathing or shallow breaths, because when they deeply breathe in, they feel pain of the chest, so they breathe, they have shallow breaths, and also they have fast breathing. We have headaches. We have fatigue. These babies are fatigued, or anybody. They are irritable. In fact, babies who have pneumonia, they are very, very irritable. We also have something called lower chest indrawing. That is when you notice that when your kid is breathing, you can see the walls of the abdomen moving in and out. Lower chest indrawing. We also have vomiting. You might find that these babies, once they feed, or they breastfeed, they vomit. They do not retain feeds. Common symptoms: number one, we have chest pains when breathing in. We have a fever. Their temperatures are always high. We have fast breathing or shallow breaths. We have fatigue. They look tired. We have vomiting. We have irritability. Those are the most common symptoms of pneumonia. So, what are the risk factors? The risk factors. By risk factors, I mean what can make someone get pneumonia. Number one, babies. Any baby who is below 2 years, that is a risk factor. Babies who are below 2 years, because pneumonia is very, very common below babies who are 2 years. Any baby who is below 2 years can get pneumonia. Any person who is above 65 years can get pneumonia. Number two risk factor is smoking. If you're a smoker, know that you are at a risk of getting pneumonia. How? Smoking affects the way our bodies naturally fight this bacteria or the viruses that cause pneumonia, and so you become prone to getting it. Smoking affects the way naturally our bodies fight the bacteria and viruses that cause pneumonia. So through smoking, you can get pneumonia. We have people who have chronic diseases like asthma. They are also at a risk of getting pneumonia. We have a compromised immune system. Anybody whose immune system is low, that is babies who are malnourished. They don't get a balanced diet, so they are at a risk of getting pneumonia. We also have environmental factors like staying in a crowded place. As we said, the viruses that cause pneumonia or the bacteria, they are contagious. They can be spread through coughing or sneezing. So if you stay in a closed room, number one, or in an overcrowded place, you're at a risk of getting pneumonia. If there's someone who was infected by pneumonia there, and then you are crowded and they are coughing or sneezing, you can get the bacteria through them. We also have people who are living with the HIV. The immune system is compromised, so they are prone to getting pneumonia. We also have under environmental factors, people who work in hospitals, because we also have hospital acquired pneumonias. So if you work in a hospital, make sure you are immunized against pneumonia. So how can we prevent getting pneumonia? Number one, make sure your baby gets immunized against pneumonia. A vaccine called pneumococcal vaccine. Make sure your kid gets immunized. Number two, nutrition. We have found out that one of the risk factors is people who have low immune system. And so people who have compromised immune system, like babies who are malnourished. So ensure that your kids get a balanced diet, and also moms, make sure you breastfeed your baby up to 6 months exclusively without supplementing with any feeds. Make sure the baby breastfeeds for 6 good months. By that way, you enhance the baby's immune system so that they are not prone to infections. Another prevention, we have babies who live with HIV. This baby, make sure if you know a kid who is living with HIV, or if you're a mom to one, make sure the baby gets cotrimazole. That one you're given in the hospital. Please ensure the baby takes the medication, so that it helps them to prevent getting other infections, like pneumonia being one of them. So how can you know a kid might be having pneumonia? For moms, number one, if your baby has a fever, if your baby has a fever, the baby is coughing, and also if you note that your baby is having difficulties in breathing or fast breathing, the baby is coughing, having a high fevers, and also if you notice that the baby is fast breathing. Also, there's another sign called nasal flaring. If you notice that when your baby breathes, then the nostrils, they're moving in and out when the baby is breathing, that baby might be having pneumonia. So please make sure you rush the baby to the hospital, so that he or she can see a doctor. So what are the complications of pneumonia? Number one, we have difficulty in breathing. That is already a complication, because the lungs are affected, so they are not able to perform their function well. So you do not get enough oxygen to your body, and so your oxygen levels will go low. And the brain needs, for the brain to function well, it needs oxygen. And so once you do not get enough oxygen to your body, you have low oxygen levels, and thus you have to be supplemented with oxygen, so that your vital organs can be able to get oxygen. Are we together? Number one complication, we have difficulty in breathing. And once you have difficulty in breathing, that means your body or your vital organs, like the brain, the heart, all your organs in the body are not getting enough oxygen, and they might end up getting you might end up getting organ failures. So you have to be supplemented with oxygen, so that your organs, like the brain, can be able to get oxygen. Another complication is we have fluid accumulation in the lungs. As we said, the lungs are filled with fluids or pus, and so with the time you might have water accumulating in the lungs, a condition called pleural effusion. Another one, you might get lung abscess, because we said it's either fluid or water that accumulates in the lungs. So you might get lung abscess. And also, now the worst complication of pneumonia is death. Pneumonia causes death, and in babies it accounts to 15% of death in babies. So please, mothers, be very keen, be very careful. Make sure you protect your baby against getting pneumonia. How? Make sure your kid, first of all, start from your home. Make sure your house is well ventilated. Open windows so that you can get in fresh air, because if you have someone in the house who is infected with pneumonia, once they are coughing or sneezing, that person can transmit the viruses or the bacteria to the rest of the family. So how can you help? Just make sure your house is well ventilated. make sure you open windows during the day so that you can get in fresh air. Number 2, avoid taking your kid to crowded places. Another thing, ensure your kid gets vaccinated, please, against pneumonia. That is a pneumococcal vaccine. Kids are given. Moms, make sure that you follow your child's clinic as advised by the nurse or the doctor. And another thing is, once you notice these symptoms in a baby, take the baby to the hospital earlier, before the lungs are much affected, so that your baby can start treatment earlier. So what is the treatment for pneumonia? Pneumonia, if it's a bacterial pneumonia, when you go to the hospital, your doctor will get to do lab works or investigations that he might need to do, and your baby will start on antibiotics. And if they start earlier, your baby will get well. So please, it's upon us, everybody, to ensure that we protect our babies from getting pneumonia, and also our elderly people. So that is it, guys. That is a brief discussion about pneumonia, and I hope you have learned something. And so I urge you to go and watch my other videos and get to know what we have discussed. And please, guys, subscribe and also share these videos with your loved ones and with your friends, because this is just basic information. Like, everybody, all moms need to know about like this topic of today of pneumonia. So it is meant for everybody, because all of us, we are prone to illness. So thank you so much for watching, guys, and subscribe to my YouTube channel, so that we might get to learn. See you in the next episode of learning. Thank you.